Hi again, everybody. Thanks for joining us on Celebrating Act Two. Art and I are with the famous Dr. Liz Lister, who is a font of knowledge about all things medical. Dr. Liz, great to see you again.
Likewise, thank you so much.
Hi, Dr. Liz. I just had robotic surgery to remove a gallbladder. And it was a week ago, Monday, about 11 days from when we're doing this now. I'm already back to the gym doing light cardio. I practice Tai Chi twice a week. I'm back into that full time. And I have to say that for what I guess used to be major surgery, I was in the operating room at 8 a.m. and I was in my house at 10:45 the same morning.
Amazing.
And I was walking around that evening, the next day, in very little, more discomfort than anything else. I was just stunned. How common is this robotic surgery?
Yes, absolutely. Well, robotic assisted surgery is getting more and more common. That is one of the major reasons that you just highlighted, is that because of the robotic assistance to the surgery, let's take the example of the gallbladder removal like you had, that used to be a pretty good size incision from around just below the sternum, kind of in the middle of your belly, going diagonally down. And it was really a very uncomfortable surgery to recover from. What the robotic assistance does is allows the surgeons to make very small incisions through which they have long instruments that they can put into the abdomen or wherever they're operating. And those much smaller incisions allow for a much faster recovery, and you are a poster child for that.
Oh, yeah. Wow.
How common is robotic assistant surgery now?
And for
It's
what
getting
other
more,
conditions besides a gallbladder?
yeah, all sorts of conditions. So all kinds of abdominal surgery. I have a patient who had a colon cancer removed with robotic assisted surgery. She did stay overnight in the hospital, I want to say for a couple of nights, but she did absolutely great. So with smaller incisions, there's less postoperative pain, there's less disruption of the muscle layers and the bowel when abdominal surgeries are being done. It's become very common for gynecologic surgery. They call it minimally invasive surgery. I remember when I was in my residency training in the early 90s, it was just starting to be introduced with laparoscopy. That was even before the robotic assistance was occurring. And I was in my residency, so we're trying to learn how to do these surgeries. However, we got kind of elbowed out of the way because our attending faculty that was training us, they were having to learn about these new techniques. And it took a really long time. It was many, many hours. So there was a learning curve for doctors. It took hours to do a surgery that when you can make an incision and look can go more quickly. That's definitely changing. So lots of surgeries that used to require big incisions, gynecology, general surgery, other types of procedures where you can use a scope are being done. So smaller incisions. The other, and you can kind of picture this, one of the incisions is for a camera. And what that allows is a very close-up look.
Wow.
All right, so you've got everything really magnified. Things are up on TV screens. Also, for example, if something is kind of in a different position where it would be difficult for a human being, I can only rotate my hand here to here, but something that's robotic assisted the instrument can bend or turn in whatever position is needed to accomplish the surgery. So it's definitely catching on and spreading across different specialties. Urology is another specialty.
Wow.
Right. So yeah, it's really great. Again, cardiothoracic, anywhere there's a cavity in the body where we can use small instruments to go in, better than making a big incision and having to go in there with our big human hands.
Sure.
And that just is a big advantage to the patient and to the recovery time.
Well,
as we've heard.
I'm definitely a poster boy for this procedure. Also, it's kind of interesting. I know it has less to do with the robotic. Maybe it does because it's such small incisions. But there are some sutures inside that'll dissolve, but the ones on the outside are all crazy glue.
That's right.
So
That's right. Yeah, we know
no
that crazy
stitches.
glue. It sure does keep skin together. Any of us who ever accidentally got some on our fingers can attest to
Yeah.
that. That's absolutely right. And it dissolves over time as the skin heals. So super helpful. It's never fun to have to go back for suture removal. So these are big advances that are helping patients recover more quickly and having less of an impact from the surgery.
Amazing, amazing advances in medicine all the time. Now, I assume we're talking about robotic assisted surgery. I assume at some point we're going to have full robotic surgery, no?
You know, everyone talks about that. Maybe I'm just an optimist, John, but I think that there will always be a role for the human factor in medicine. If you've had this experience, when you go in to have a surgery, there are multiple people who make sure that the correct surgery is going to be performed in the correct area of your body.
Yeah.
So I think that these technologies are very helpful, but I still think that the human factor is important. I don't think we'll be replaced quite that easily.
For more on Celebrating Act Two, visit our webpage, follow us on Facebook, subscribe to us on YouTube, and tell your friends. Celebrating Act Two is the user manual for the second half of your life.